Here. Good evening, everybody. I'm really flattered to address this in August meeting here. And Your Excellency, Bob Blackman and Virendra Sharmaji. And I really thank Bhamraji to get me here. What we are doing, here in India is translational research of Ayurveda. We were the first in the world to actually model the doshas in experimental animals and establish molecular effects of doshas. And we identified over 4,000 markers for Vata, Pitta, and Kapha. We were the only ones to regenerate dead hearts in experimental animals. And we do it repeatedly in many of our end-stage terminally ill heart disease patients, who routinely come to our clinic or to our hospital with EFs less than 30. We routinely help them improve the ejection fraction of the hearts. And we've helped several people with ischemic strokes and, routinely treated several diseases with refractory diabetes, refractory asthmas, allergies. All this was possible because we did a lot of translational research, really understand the doshas at a molecular level. And, for understanding pharmacopoeia, we need to understand, I suppose, polypharmacy. Ayurveda, as I see, is a very advanced form of allopathy. That's why we put several disciplines together: the allopathic understanding, the Ayurvedic understanding, translational research, the manufacturing practices, Python, data science. And I'm a data scientist myself. I'm a cardiovascular surgeon, and I'm a naturopathic doctor, and I'm undergoing a BAMS course here in India. It's really fascinating. This is a very deep science, friends, and I would want to share that, this science has the potential to treat emergencies as well. That's the hallmark of success of any medicine. I'm not bringing in the debate of Ayurveda versus allopathy, but as I said, Poly-Scientific Ayurveda is a very advanced form of allopathy, friends. This has been my back in India, we are a team of 20 doctors working together, and this can really really help even the NHS that spends over 10 billion years on diabetes. We can reduce the cost to just 1% of whatever you guys are spending right now. We all know that there are about 4.7 million people with diabetes in the UK. And in 10 years, UK is going to spend 95 billion pounds on just diabetes, the NHS. And I promise you, we can reduce it to just $5 billion. And this is possible, friends, because we routinely treat several patients with diabetic food. People who, these are all anecdotal studies. Definitely, they would require a lot more studies. And the beauty of this science is, the beauty of what we are practicing here is that we're able to quantify the doshas at individual organ levels. And then, as per the Ayurvedic understanding of bringing this, when you bring the doshas to a certain balance, the body automatically sets itself into a self-healing motion. And then without understanding the interactions or the vata, pitta, kapha at every level of biological interaction, we cannot bring that balance. So that's the research that we've been doing the past 20 years. And we have come to a very brink of a great revolution in terms of bringing in an advanced technology that could actually detect the imbalances of these vata, pitta, kaphas, quantify them in several organs. And not only that, in this device that we are coming up with in the form of an advanced IoT platform for health, also detects your blood biochemistry. In the first phase, we're planning to bring the blood biochemistry in the form of blood glucose, the HbA1c, lipid profile, completely non-invasively. We don't even have to draw a speck of blood. The clinical trials are underway. I thank you. I completely agree with Dr. Tony that UK had always been the center of knowledge, and if research could be done more in the UK, this can really go all across the world. And this is what we truly believe here. Thank you very much for this opportunity. And I truly believe that in the Ayurvedic way, we could save money and also save lives across the world. Thank you very much.